Welcome to Kitchen Party Rebel. My name is Kate, your host, a politics student coming to you from my kitchen table here in Mi'kma'ki, the unsurrendered ancestral territory of the Mi'kmaq people. You probably know it better as Nova Scotia, though. This season, we're looking at healing the body politic. We're using two-eyed seeing to diagnose societal illness and relational imbalance in structures of power like our government. I can't wait to share it with you, so let's get started. All right, my loves, come on in, grab a chair. Maybe not that one. That one's a little wobbly. All right, let's talk about something light and cheerful today, eh? The chronic illness of the modern nation state. Okay, I know. But trust me, this is kitchen table kind of conversation. Because it's about our bodies, our relationships, the land under our feet, and the stories we've inherited about who deserves what. Tonight, we're diagnosing the body politic, and the prognosis is a bit complicated. All right. Well, to get to a diagnosis, we need to name the illness, right? So here's the thing: political theorists, aunties, community organizers, and anybody who's ever tried to get their kid registered for basic health care in this country can all agree on this. Canada, and really most of the Western world, is running on a political immune system that's been compromised for centuries. Oppression is not a glitch. As Anne Bishop, author of Becoming an Ally, tells it, oppression is a system of interlocking structures: political, economic, ideological, and physical. They all determine who holds power and who is constantly just fighting to breathe. It's not random. It's definitely not accidental. It's completely by design. And that design lives in us, in our stress levels, in our health outcomes, in our social norms. It lives in who gets listened to and who gets forgotten or ignored. So tonight, we're going to name that design. And naming is the first step to healing anything. Just ask any doctor, elder, or your nosy neighbor. All right. So to understand where we are, we got to take a little bit of a historical detour. Don't worry, this is not one of those high school ones where someone reads you a list of dates while you silently die a little bit inside. Picture this: Sicily. No, just kidding. But if you get that reference, kudos. Picture this: England. 17th century England. The enclosure movement rolls in like a bad landlord, fencing off communal lands that people had depended on for generations. So basically, look at it this way: you've got a bunch of people in 17th century England, and they're all working communal farmlands. Everybody's living off the land, working together. Everything's happy. And then all of a sudden, the government decides that they're going to fence it off and allocate parcels of the land to people. That's not an economic shift. That's a complete moral makeover. Suddenly, ownership of your little plot of land equals virtue. Shared land becomes inefficient. Cooperation is recast as naivety. Anne Bishop argues that this planted the seed for our entire modern system. Domination becomes the blueprint. Power over the people, not power with each other. And you know what happens when a blueprint gets exported? It gets shipped across the ocean and slapped down on Turtle Island. Consensus governance? Matrilineal systems? Ecological balance? Ah, no, we don't do any of that. All of that gets shoved aside for the colonial state, a state that claims sovereignty not through relationship but by declaring itself the only adult in the room. Jody Wilson-Raybould is a former MP in Canada, but also an author. And she reminds us that colonial governance was not messy or confused, it was intentional. It was designed to erase Indigenous law. It replaced Indigenous authority, and it centralized power somewhere far, far away from the people who lived on this land since time immemorial. This, unfortunately, is not a metaphor. It shaped the way our governments follow. Let's try that again. It shaped the way our governments form policy today. Let's bring this a little closer to home, literally. Oppression doesn't just show up in textbooks or political speeches, it shows up as illness. It shows up as anxiety and diabetes and heart disease and higher mortality rates in Indigenous, Black, and marginalized communities. Elizabeth McGibbon, who wrote the book Oppression, argues that oppression is actually a social determinant of health, meaning you can pretty much predict someone's life expectancy based on their exposure to racism, colonial violence, and structural neglect. That's wild, right? But also not surprising. Um, there was a really interesting book that I read over the summer called Rehearsals for Living, and it was a conversation. It was letters written between two people over the course of the pandemic, and in these letters, something that stood out to me was a quote that said that they had to trust the white healthcare system because there was an urgency there, because we know that Black, brown, and marginalized people are always the first to die. That that's more than a little bit wild. And the settler in me, the privileged person in me says they're not lying. In every system you interact with, from the classroom to the emergency room to the income assistance office, tells you you're less valuable. That's not just demoralizing. The more that you hear this over and over and over and over again your entire life, it's biologically damaging. We see it everywhere across this country. We'd like to think that everybody in Canada has access to clean water. They don't. There's reserves up north that haven't had clean water in decades. Adequate housing. A year ago, almost to the day, uh, my town that I'm sitting in now had someone freeze to death outside their tent because there was not enough adequate housing here. Happens every day. Mental health care. I know people who've been on a waiting list for a mental health practitioner for years. And trust me, if you're having a psychedelic or a psychotic break, you don't have years. You have maybe minutes. What about safe birth experiences? I'm not talking about hospitals. Safe birth experiences are culturally relevant birth experiences. Same with safe death experiences. Sounds like a weird irony, but there is such a thing as a good death. These things are all political decisions. And when those decisions follow the logic of domination instead of relationship, the body politic gets sicker. Canadians love to think of ourselves as the polite older sibling of global politics. We say sorry when you bump into us. We have free healthcare. We've got rainbow crosswalks, they're so pretty. We have Reconciliation Day on September 30th. But those are all masks. And the thing about masks, they hide a lot. That book that I was talking about before, Rehearsals for Living, it's written by Robin Maynard and Leanne Bedasamosake Simpson. I really hope I said that right. Call this in their book the architecture of captivity. It's the way Canada has built systems designed to keep Indigenous and Black communities contained, surveyed, under resourced, and ultimately blamed for their own constraints. Yeah, we're going to, put you in a little box and then we're going to blame you for your own issues in existence. We're talking systems here, not individuals. Although there's certainly individual oppression as well. But systems, they shape things like police budgets and school curriculums. And even in an emergency room, systems assign value to someone's pain. If you've ever walked into an emergency room and had the triage nurse ask you, on a scale of 1 to 10, how bad is your pain right now? You've experienced it. Fun fact, not all of us experience pain the same way. And just because I might say 10 doesn't necessarily mean that that nurse is going to treat me the same as a 10 with dark skin or a 10 that clearly doesn't have secure housing. If oppression is a structure, then healing has to be structural too. Okay, this has been a little bit of heavy part of this episode, so here's where we turn the corner. Okay, we're not just here to diagnose the sickness, because just because you have a diagnosis doesn't mean things get any better, and we're trying to imagine the healing here. Maynard and Simpson talk a lot about rehearsing freedom. That's their book, Rehearsals for Living. Rehearsing freedom is the small daily acts of imagining something that does not rely on hierarchy. And as Anne Bishop reminds us, if oppression is learned, then it stands to reason that it can be unlearned. If domination is normalized, cooperation can also be normalized, right? So, healing the body politic isn't about some grand national apology on a grandstand podium from the prime minister, although that does help. It's about shifting our relationships. It's about truth and truth seeking. It's about self determination, restoring power with each other instead of feeding power over. It's political, it's intimate, and it's absolutely possible. So, yes, the body politic is sick, and the diagnosis is pretty darn serious. But you've heard the aunties say it. You can't heal something you refuse to look at. Tonight, I hope that we looked at it. And next time, we're going to get a little closer. Because the next episode is all about how power shapes our health and our politics in ways that most of us have never been taught to see. So, rest up, drink some water, text somebody you love, stay rebellious. I'm out.